everybody, it's Jenny from MedEd again, your CNA instructor. So the next procedure I'd like to go over with you is fingernail care. So sometimes the activity department does fingernails, but not always do they get to everybody. So that does fall back on the CNAs. You just want to check while you're doing your daily care. If their nails are dirty or jagged, perform your fingernail care. So we start by getting a report by talking to our nurse, asking about our residents' needs, abilities, and limitations. I'm going to knock on the door, request permission before going in. I'm going to introduce myself by name and title, call them by the name they prefer, and explain what I'm going to do. Find and gather your supplies. So the supplies you need for fingernail care: you need an orange stick. An orange stick is used for cleaning under the nails. We need a file, and then some clippers. I've got my wash basin, a towel, and gloves to protect myself. I'm going to close the curtain, drapes, and doors, wash my hands, wear gloves as needed for body fluids, and use good body mechanics. So before beginning fingernail care, there are 6 observations you need to check the hands and nails for. We're checking for color, swelling, cuts, or splits. Feel the hands for extreme heat or cold. So those are the 6 things you check before you start fingernail care: color, swelling, cuts, splits, heat, and cold. If there's nothing wrong, raise the head of the bed. Fill your bath basin halfway with warm water. Have the resident check for comfort if they're able. And then we just want to soak their hands. So just have them put their hands in the basin and just let them soak. It doesn't say for how long, so this is going to depend on how jagged and how dirty those nails are. Once you've soaked them, just pat the hands dry. Now we're going to put on gloves, because what's up underneath those nails is probably not what you think. So do not assume that the green underneath their nails is from their dinner last night. Do not assume that the brown underneath their nails are from playing out in the dirt, because obviously they don't play in the dirt. So protect yourself with gloves. Now these next 3 things we have to do in order. So first you clean under the nails with the orange stick. So you just take the orange stick and clean underneath the nails. Both hands. When you're using fingernail clippers, you clip the nails straight across. That's going to prevent injury to the skin. So we just clip them straight across, both hands, and then you use your file to round the edges so they're not rough. Take your file and round the edges, both hands. Place your towel in your dirty linen bag. Take off your gloves. Wash your hands and do those final steps. A, check alignment, make sure they're comfortable. B, make sure your bed's in the lowest position. C, make sure they have their call light and water within reach. D, ask them if there's anything else they need. And E, everybody deserves a thank you, so thank your resident. F and G, find and gather your supplies, clean them to company or facility policy. H, how do you want those hanging curtains, open or closed? And then I your way out. I'm going to wash my hands. I'm going to do a visual safety check of the room and environment, report unusual findings to my nurse, and document my procedures. Thanks for watching.